My name is Devin George. I'm the Chief Programs Officer here at Cribs for Kids. And over the next 10 minutes or so, I'm going to talk about the National Safe Sleep Hospital Certification Program. Cribs for Kids Hospital Certification Program recognizes those hospitals who are committed to provide infant safe sleep care, all in an effort to reduce SUID, ASSB, and SIDS, as well as prevent unsafe sleep injuries. Our hospital certification program is anchored in the AAP recommendations for a safe infant sleeping environment, and it's also rooted in the research that demonstrates at-home modeling of what's done during inpatient care. So based upon the safe sleep efforts of each hospital, a bronze, silver, or gold designation is conferred for a 5-year period, requiring annual report submissions. So before I talk about some of the specifics of the hospital certification program, I want to take just a minute and talk about where it came from. Back in 2010, Judy Bannon, our executive director and founder, worked with like-minded, involved people across our state and managed to get Act 73 passed. Act 73 recognizes the importance of modeling and normalizing safe sleep in an effort to prevent SUID. And that means basically families do at home what they see done in the hospital environment. As such, Act 73 of 2010 requires hospitals across Pennsylvania to provide safe sleep education to families and caregivers that are discharged with an infant. So based on the response of Act to other states and agencies across the country to Act 73, Judy felt it would be a fabulous program to take the tenets of that bill and develop a hospital certification program. She worked hand in hand with Dr. Mike Goodstein, our board member and medical advisor, and his hospital, WellSpan York Hospital, to develop the hospital certification program. Launched in 2015, WellSpan York became the first certified hospital, and that program is now available to any hospital caring for patients under the age of 1. And it's super important to note that this certification comes without any fee. Okay. So the hospital certification program design and requirement. First, in order to be a safe sleep certified hospital, the hospital must have an infant safe sleep policy. There are particular requirements of that safe sleep policy, and those are outlined on our toolkit, and I'll talk about that in just a second. The hospital also has to commit to using safe sleep images, and they also have to agree to include safe sleep education on their hospital website. Once a hospital decides that they'll apply for certification, they can apply for certification at one of 3 levels: bronze, silver, or gold. The bronze level means that they've got that hospital policy, they're using safe sleep images, they've got safe sleep education on their website, that they train their healthcare team members according to the safe sleep policy they have, and they also educate their families and caregivers according to that safe sleep policy. Silver safe sleep hospitals do everything that a bronze hospital does, but they also do safe sleep audits or have a safe sleep quality initiative. They use or distribute wearable blankets, or instead of wearable blankets, because we found that to be a cost barrier sometimes, hospitals can also complete house-wide safe sleep education. And then the next level is gold, where those hospitals meet all of the bronze and the silver requirements, but add to that a minimum of 2 channels of community outreach on safe sleep education, meaning that they're talking to people outside of the hospital about infant safe sleep. And the gold hospitals also assess for and provide a safe sleep space for their families. To earn safe sleep certification, Cribs for Kids has developed great online support, guides, and tools. On the previous slide, you may have noticed that that was our quick guide that helps hospitals pretty easily assess where they might fall in the certification levels if they want to do bronze, silver, or gold. That quick guide is available, you can see right on our website on this link. We also have a hospital certification manual that walks hospitals through all of the requirements. We also have a site self-assessment or a virtual site visit. Because we don't visit hospitals for certification, we do require hospitals to submit a pretty in-depth report on the safe sleep work that they do in their hospital. And to aid in developing that report, we have their virtual site visit or site self-assessment tool. And we also have a hospital certification toolkit. Our toolkit is pretty dense. I really hope you'll go out and take a look at it. Even if you're not interested in certification, there's so much great information out there. So if you go to our hospital certification toolkit, you'll see a library of healthcare team member training. You'll see a library and links to a lot of family and caregiver education. You'll see links to great community outreach efforts. There's great samples of infant safe sleep policies. So again, even if you're not considering hospital certification, we hope that you'll go take a look at that toolkit. Keep in mind that hospitals aren't required to use the information or the tools that we have on the toolkit. It's really there for those hospitals that perhaps aren't incredibly resource rich and want to have a turnkey way to earn certification. So all of that is out there to support that effort. A quick guide, a manual, a virtual site visit form, and our toolkit. We also offer Safe Sleep system-wide certification, meaning that if my hospital is part of a system and we have maybe 3 or 4 birthing hospitals in that system and a children's hospital, and we all use the same infant safe sleep policy, we can apply as a system, while at the same time each hospital earning their level of certification based upon whatever safe sleep care they provide. In addition to all of the online tools we provide for hospitals to earn safe sleep certification, we also have some great products designed for hospitals and to support their safe sleep efforts. One is our cribette, which you may be familiar with as our key product, but it's also available to be used in hospitals. It can be easily cleaned. So we find that some hospitals are using it in adult rooms for readmitted mamas, for example, so baby has a safe place to sleep. And it can also be used in emergency rooms, so those babies have a safe place to sleep. We have a wearable blanket program for our hospitals using both our Swaddlette and our Snoozette. We also have developed a badge tag and badge reel specifically for safe sleep education. So you can see that there with the 9 steps, and nurses can easily pull that down and review that with their patients. We have the door hanger that is a super simple, convenient piece of education to send families home with. And we have our Safe Sleep Sammy and Safe Sleep Sasha, which was designed as a toy kit for siblings, but we're finding that hospitals are using it for education purposes, both bedside for families who perhaps who aren't native English speakers and use that for demonstration, or using it in education classes or safe sleep outreach events. The other piece that we provide is the photo placard, which you can see right in the middle there. We have found that some hospitals were not certifying because they had invested a lot of money in artistic photos on their unit, those kind of, Ann Getty style photos where baby is sleeping on a mushroom kind of thing. And again, not that we think that anybody would put baby to sleep on a mushroom, but the commitment is to safe sleep images. So we developed this placard that can be placed on those photos that states this photo is for artistic purposes only and does not reflect AAP's safe sleep recommendations. Again, those products are all there to support hospitals as they seek certification. Okay, so your hospital has determined that it's going to apply for certification. You've got your infant safe sleep policy in place. You know that you're using safe sleep images. You've got infant safe sleep education on your website. You've got your healthcare team member training in place. You've got your family education in place, and any other of the elements that would link to silver or gold certification depending upon what the hospital is applying for. So then what? So you go to the cribsforkids.org/ the virtual site visit apply button. That's in the pink menu box that I showed earlier. And you do just that. You complete your application and submit it online. When you do that, you get an automated message that tells you that it's been received. If you don't get that message, that means that it wasn't received. That message also tells you that you will get a complete review of your application within 30 days. We will send that application review to the 2 contacts for the hospital that you put on your application, and then we ask that the hospital do their best to respond within 2 weeks. The fewer items that need to be addressed, the faster and more efficient that certification process positively is. We do expect that applications close within 90 days. We do extensions on a case-by-case basis. Once you've achieved, if you've gone into 6 months of applying for certification and haven't rectified some items that don't meet certification requirements, you may need to send an updated site assessment. And if we get no response, applications are withdrawn for being idle. But of course, we do notify hospitals in that regard. Okay, so your hospital submitted its certified hospital application because you and your team who were working on this certification did such a great job using the policy checklist, following the site assessment guide, sending all of the required information. Congratulations, you efficiently earned certification for your hospital. So what happens next? Well, first you'll receive an email either from myself or from Kaylee awarding you that certification. There will be lots of great information in there. Then you'll also get a package in the mail that includes your certification plaque and some sample education materials that you might be interested in using, and also your official award letter. You see some of these fabulous nurses who earned certification for their hospital holding those things just right there. You'll also begin to receive on the first Friday of each month our certified hospital notes, which is an e-newsletter specifically for our certified hospitals. You'll also receive a password to access the certified hospital portal. That's where you'll go to submit your annual report each of the next 4 years. It's also where you might upgrade when you submit your annual report, and it's also where you'll want to be sure to keep us updated on the current contacts for safe sleep for your hospital. So you've earned your hospital's 5-year safe sleep designation, and that means you join our fabulous family of other certified hospitals. Who are they? As of April of 2022, we've certified 487 hospitals for their infant safe sleep care. Right now we have 471 certified hospitals, and that difference comes primarily from hospitals that have closed or closed their OB units. Of our 471 certified hospitals, nearly half of them are gold certified, and about 28% are silver and 25% bronze certified. We have certified hospitals in 46 states. We've certified 4 military hospitals, a couple in the US, 1 in Japan and 1 in the UK. We've certified 2 hospitals in Canada, and we've even certified a hospital in Israel. The hospital is in Jerusalem and has a shocking 22,000 births each year. And they have now been proxied to certify hospitals across Israel as well. The growth of our Safe Sleep Hospital Certification program comes not just from the hospitals themselves, but also from some important collaborative efforts. For example, Cribs for Kids worked with the state of Maine and their Department of Health to ensure that all 26 birthing hospitals in the state of Maine achieved a minimum of bronze certification. And we have done that, and congratulations to the state of Maine for that. We've also worked, for example, with the state of Oklahoma to develop a statewide safe sleep policy that any hospital in Oklahoma can use for certification purposes. We're working with states like Florida and Kansas as they work to target hospitals for certification in counties that have higher SUID rates. And we've also worked with the states like New York and Tennessee to provide a safe sleep space solution to hospitals to ensure that those families leave with a safe sleep space for baby. We've also worked with the hospital associations in places like Indiana on a concerted effort to get their hospitals certified. Indiana boasts the highest number of certified hospitals of all of our states. We also have state safe sleep champions for hospitals in states like Arkansas, West Virginia, Missouri, and the Dakotas. And we also work with agencies in states like Liz Montgomery and her NISA organization, which covers 4 states in the Northwest, as we collaborate to have those hospitals certified. We also do offer, as I mentioned earlier, system level certification. We launched that in 2020. Since then, we've had several hospitals apply for certification for their individual hospitals within that system. System level certifications include Allegheny Health Network, Ascension St. Vincent, Ballad Health, BJC Healthcare, Erlanger Health, Northern Light, Parkview Health, Wellspring Health, and UPMC. To understand the impact of certification, the results, and the experiences of hospitals who have become Safe Sleep certified, we welcomed hospitals to submit their abstract for our 7th National Cribs for Kids Conference, Mission Possible. That actually is happening May 3rd through the 6th. We have an entire track of hospital plenary sessions and panel discussions. So it's a great way to learn more about what hospitals are doing for community outreach, their QI initiatives, and all of those elements associated with hospital certification. We also do have a First Friday Hospital Notes e-newsletter that I mentioned earlier. You don't have to be Safe Sleep certified to receive that newsletter. If you'd like to add your name to that mailing list, I will happily do so. Just send your name, your email address, and your organization to hospitalcertification@cribsforkids.org, and we'll be sure that you receive that First Friday Hospital newsletter each month. If you'd like to look at past newsletters, those are also available on the Hospital Certification Toolkit. They are chock full of great information on what hospitals are doing, updates on products and legislation, Again, just like the toolkit in and of itself is a great resource for safe sleep information, the hospital newsletter is a great way to get that pushed to you. Thanks for taking the time to learn about Cribs for Kids Safe Sleep Hospital Certification Program. And thank you to you and your team members for what I know are the good works you do each and every day for infant safe sleep. If you've got any questions or suggestions about our program, you can email us at hospitalcertification@cribsforkids.org, or feel free to connect with Kaylee or me individually. You see our email addresses here. And I hope you've enjoyed the photos that were included in this presentation. They were photos sent to us by certified hospitals when they received their certification awards. So we really appreciate them sending those good moments of their team members celebrating their designation award. Thanks so much.